the health of people at midlife and older ages is much better today than it was 30 years ago. There's some concern about what the future will bring. We're seeing some slight increases in disability rates among people in their 40s, concerns about growth in obesity rates, growth in diabetes rates. All of those are a little bit disturbing, I think. But we focus so much on the obesity epidemic that we lose sight of an even bigger trend, which is dramatic declines in smoking and how that translates into much better health at older ages. So it's clear that despite some concerns about what the future might bring in terms of health status, that older Americans, midlife Americans today are much healthier than they used to be, and that jobs are less physically demanding than they used to be. As we shifted from a predominantly manufacturing economy to one based on services, there are just fewer jobs that require lots and lots of physical effort. That allows people to work, more people to work in their 50s and early 60s. Now that doesn't say, I don't mean to imply that these physically demanding jobs don't exist. They do, and that creates problems, I think, for people in those jobs who want to work longer. And so what happens to them? One of the things we do find, though, is that about a quarter of people change occupations after age 50. So a lot of people who start off in physically demanding jobs when they're young transition into less physically demanding jobs when they're old, and so are able to stay in the workforce. And it's definitely clear that many, many older people are able to work and want to work and do want to contribute. And it's not just the paycheck. If you look at participation rates, labor force participation rates at very old ages, at 70, at 80, it's always people with lots of education and lots of money who aren't working for the paycheck, but they're working just to give life meaning.
If we actually look back in 1940 when Social Security was first established, or even 1950, the average age of retirement was 68. The eligibility for benefits was 65. Average age of retirement was 68. One has to be careful too, because 68 today is not the same as 68 50 years ago, or as the common expression is, the new 50 is the old 40, or whatever, or the new 60 is the former 50, or however it's expressed. So if I translate this age 68. And the number of years of life expectancy people had then to today's terms, it would be about 75. That is, if we were to retire today for about the same number of years as we did in 1940, men would be basically men and women would be retiring about the age 75. And our projections show that if you go forward another 50 years, that would be about 80. So the difference between 75, the equivalent retirement age of 68 in the past, and when people are retiring today, which is about 63, 64, is quite substantial. We're pretty close, depending on how you do the accounting, and there's different ways of accounting, we're pretty close to retiring for almost an additional decade relative to the past. And that's at the point in time when our health has become better and physically demanding jobs have become less. So I think what this tells us is that one reason that we started retiring earlier and earlier relative to our life expectancy is simply that we had a wealthier society, and we decided that we wanted to spend more of our national wealth on retirement. A lot of cases it was our private wealth, but in a number of cases it was also the government resources that were made available. And as I commented earlier, I think much of this was made possible by the fact that that there were resources in society. There was a labor force from women and baby boomers and others that were able to fulfill those demands. I think that's shifting, and I think what we're going to see is somewhat of a trend backwards, if not necessarily towards rapidly increasing the number of years spent in the workforce. Certainly there will be an increase in the number of years spent in the workforce. And the good news again is that I think relative to the past, we're healthier, jobs are less physically demanding, and we've actually been retiring for a lot more years than in the past when we proved we actually could work.